That's our core competence.
So if there can be some policy measure to ensure that that is promoted.
Firstly, the traditional medicine does not go in the scientific process or qualification. So, number of laboratories, there is an exclusive department has come for traditional medicine, the Department of Health, Ayush. So, those fellows, a network they are establishing for testing and clearing the medicines.
Sir, I think there is also an issue of accountability that needs to be introduced in the healthcare system, because there are instances where medicines which are mandated by the government to be distributed freely, such as quinine, even these are sold outside the primary health centers in the rural areas. So obviously the people who are responsible to ensure this are not really living up to the standard that is expected. So there is obviously that issue of accountability that needs to be tracked, and probably very stringent action needs to be taken against such misgivings like these people.
That is, citizen, how do you, see, after all, everyone is be accountable, isn't it? What he does, what she does. And government cannot teach morality. Can they teach morality? That means I am going to give a talk in October, general lecture here, open lecture. How do we evolve enlightened citizens? You know, how to evolve? It's not only that the economic prosperity is going to help us. We should become, from our civilization's heritage, we were good citizens, enlightened citizens. How to do that, I made a model. I'm going to share with you all. Okay?
So, in the healthcare sector, one of the reasons for low quality in government hospital is that the demand far out of the supply, so the quality level goes down. But at the same time, we have a situation that, especially in tier 2 and tier 3 cities, in small towns, you have private doctors with their own clinics, and nobody goes to them. They are almost out of business for most of the time. And at the other hand, we have the government sector, or big public in big cities, big hospitals, where there is heavy congestion. So perhaps we should look at linking, and not only in the private sector, even in dedicated hospitals like railway hospitals, the capacity is not fully utilized to the extent it could have been.
Yes, that has been happening.
So the available capacity in private sector and other public sector, if that can be utilized, then immediately access to healthcare can be increased, and the pressure on the hospital like PGI in Chandigarh, which was supposed to be a specialty hospital, and which ended up becoming a general hospital, that pressure can be reduced and the availability of healthcare can be increased to everyone.
We should evolve on the health side some suggestion, great suggestion. I want to give two or good examples in the prevention area and insurance, health insurance. So we will discuss after getting the ideas. Yes.
So I think one more factor is the amount of spending that goes into healthcare sector. And our health insurance industry is not as consolidated as it's in the European countries or in the US. So typically it's like 20% spending by the government and 80% from the personal. So maybe that's one area we need to look at. And some programs like Chiranjeevi that has been successfully implemented in Gupta, which that actually bolsters that the community which is which might have access to the resource, but it's not able to afford the resource. So that actually takes care of that dilemma in their mind. Which can be looked at.
Chiranjeevi is working.
Yes,
Full shape.
Fantastic.
I think, sir, apart from increasing the capacity of giving good healthcare services to the people, there is also one drawback in our system is that there is, even we like it or not, there is a huge cartel between the pharmaceutical companies and doctors, due to which the cost of accessing the medical treatment and medicines, it becomes too costly for very common people, and that is the reason why a normal person afraid to go to a specialist doctor, because once he goes there, I mean, he is prescribed by so huge and costly treatment that perhaps he may not be able to afford it. So till we do something extraordinarily different on the health front, I mean, expanding the capacities and all those things, are we in need of some stringent laws which can prevent such kind of cartelization and exploitation of the consumers? And because here there is no protection and there is no option available. When I am sick, I have to go to a doctor, and when he prescribes a medicine tablet which is costing me 80 rupees or 90 rupees, and then he prescribes 10 tablets within 3 days, I don't have any other option but to use it. When everybody knows that the price, actually manufacturing cost of this medicine is less than 1 rupee, 2 rupee, but they are charging exorbitantly high.
You don't question that. See, they say the generic medicine in India many times lower. Only 2 years medicine should be banned, with that punishment. But as a medicine, India is the cheapest, they say.
Yeah, that's true. But normally as a consumer, as a patient, our Indian patient does not have that courage to ask a doctor that instead of this costly medicine, can you prescribe a cheaper medicine? He will say, no, whatever I prescribe, you take it. And most probably in extreme cases, the medicine prescribed by a particular doctor will be available only to few stores just outside his clinic. And if you go 2 kilometers away, you will not be able to get that medicine. Because there is clear nexus between these people, and there has to be some stringent laws to control this kind of nexus.
I have introduced a term, what's called diagnostic pain. What is diagnostic pain? You go to a doctor, that guy in a big hospital, they prescribe. You go through so many tests in cardiology, urine, and then multiple blood pressure, this, we have got multiple places. So this fellow, he went for a treatment. When he sees that type of test, he was going to diagnose. He's still not diagnosed. He has to go through all the tests. Then he will be diagnosed. And the doctor will tell him. By that time, he has got the diagnostic pain. Because money, he needs a lot of money. So one of the major requirements is how the doctors can be primary cancer. 90% of the disease, common disease. Only 10% special disease. So 90% should be treated in the primary health centers. We have to make it work in primary health centers. Okay, friends? Any health sector? Yes.
So like we are saying, if you want to really make the primary health sector work, I think like we need more health professionals, and we have dearth of doctors. If we take off any other education, any other form of specialization, be it engineers or anything, we have 1 year specialization course, we have 2 years certificate course, diploma course, degree course. Whereas in medical, we don't have anything like that.
See, medical, I'm pushing that idea in Philippines. Philippine National College, they got a famous, Philippines are famous for nursing.